It's hard to understand just how debilitating dizziness can be unless you've experienced it yourself, and those that have experienced it are often misdiagnosed, told there's nothing that can be done, or told that it's all in their head. Well, I'm here to tell you that diagnosing many dizziness disorders is actually not super challenging. There is something that can be done a lot of the time, and dizziness oftentimes is technically all in your head, but not in the way that you think. By understanding the type of dizziness you're experiencing, combined with how and when it began and what aggravates it, we can get a pretty good idea as to the condition you're living with, what types of assessment you might need, and what you might do to fix it. First off, when a patient tells me they're dizzy, they really aren't telling me anything useful. And that's because dizziness is a category of symptoms, not a symptom itself. There are lots of ways to feel dizzy. Maybe you feel spinning sensations, also known as vertigo. Maybe you feel a waving or a floating sensation. Maybe it's unsteadiness, lightheadedness, clumsiness, double vision, or motion sickness. All of these symptoms can fall under the umbrella of dizziness, and understanding the type of dizziness you experience can help guide us to the cause, because there are many different causes of dizziness, and to be honest, there's still a lot that we don't know. But we do know that sometimes you might feel dizzy from a fever, an infection, low blood pressure, anemia, electrolyte imbalance, autoimmune conditions, with migraines from trauma, trips in a car, boat, train, or plane, as a side effect of medication, or sometimes just because without any discernible reason. You might experience symptoms when you're laying down, when standing up, when moving, when staying still, or even all the time. But through all of this, it's believed that many dizziness conditions boil down to one concept: body awareness. Body awareness is so important that your body has multiple systems built in to make sure that your brain knows exactly where your body is. There are three main systems that accomplish this. The most obvious is your eyes. They give you a physical picture of your surroundings. Next is your proprioceptive system, which are sensors in your muscles, joints, and skin that give the brain an idea as to where each muscle and joint is. Last is your vestibular system, which are a series of fluid-filled tubes deep inside your ears that give your brain information about movement of your head. You ever notice that it's harder to balance when your eyes are closed or when you're in the dark? This is because the brain trusts the eyes more than any other system. So to keep you balanced, it will try to rely on your eyes first, followed by your muscles and joints, followed by your vestibular system. When standing still on a solid surface, the brain is taking in info from all three systems to keep me steady, but it's relying on my eyesight far more than the other two systems. Let me show you each of these systems in action. Watch what happens when I close my eyes. Notice that I begin to sway slightly. Since the brain can't rely on my eyes anymore, it starts to rely more on my muscles and joints and my ankles and my vestibular system. I don't have as much body awareness, so my balance gets worse. Now let's try this on an unsteady surface. Now my brain can't rely as much on my ankles, so again it defaults to my eyes to keep me steady. My brain really trusts my eyes, so my balance isn't much worse than it was when I was on a solid surface. Now look what happens when I close my eyes this time. We're now forcing my brain to use my vestibular system alone to maintain my balance, which is challenging. In order for the brain to have solid body awareness, all three of these systems need to tell the brain the same message. Those messages must be communicated correctly to the brain, and the brain needs to be able to properly analyze all that information. If one or more of the three systems begins to tell the brain something different than the others, if there's an issue with the transmission of these messages, or if the brain is having trouble processing all this information, you might feel dizzy. Issues can arise at any step of this process. There can be an issue with the vestibular system, muscles and joints, or eyes themselves, an issue with the nerves that connect those parts of the body to the brain, or an issue with the brain itself and its ability to process that information correctly. Most of the time, spinning sensations or vertigo is caused by issues with the vestibular system or the nerve that connects the vestibular system to the brain. Double vision can be caused by issues with the eye muscles themselves or the nerves that control eye movements. Unsteadiness and clumsiness can be caused by issues with your muscles and joints as well as issues with your vestibular system. But problems with the cerebellum or brainstem directly may also cause these symptoms. This is why your balance and coordination are worse when you're drunk, as alcohol affects the cerebellum. Waving sensations, floating sensations, and motion sickness are typically caused by issues with how the brainstem and cerebellum process information coming in from each of the three systems. Lightheadedness is sometimes caused by issues with how the brainstem and cerebellum control your vital signs, but could be completely unrelated to all of this. It's also common in fever, low blood pressure, anemia, medication side effects, electrolyte imbalance, and more. Success rates with dizziness rehab vary wildly. Some types of dizziness can be fixed in a few minutes. Others honestly may never respond. Either way, rehab is always worth a shot. And luckily, there are a growing number of dizziness rehab specialists. Please search for one near you. In the meantime, I hope that these videos will give you enough tools to get you started on your path to recovery. And if you're having trouble building a strategy to help your dizziness, you can always contact me to schedule a consult at virtualbrainrehab.com. If you learned something from this video, give it a like. If you want to learn more, please subscribe. If you have any questions, leave a comment below. This is Dr. P, and I'll see you in the next video.